So with this one, we're going to be talking about applying extremity restraints to a patient or a client. We want to make sure that it is absolutely necessary and that we obtain and secure an order from the healthcare provider. We will then bring our stuff with us, perform hand hygiene, identify yourself and provide privacy. I would then identify the client with 2 identifiers and explain the rationale for what we're doing and to remind them that it is only temporary. When planning the care, you do want to include family and friends based on what the client wants, clearly. You are then going to put on the restraint according to the manufacturer's steps to do it. So this will be our restraint today. If there's any bony prominences, you want to make sure that those are padded nicely, and always have a soft cushioning on the restraint, on the touching the skin. We're going to go ahead and raise the bed, move things out of the way, and lower the bed so we can assess the extremity that we will be applying the restraint to. Again, I've already provided the rationale, made them comfortable, and we're going to go ahead and put it on, making sure the padding is on the skin. We're going to secure it in place. Trickier when you don't have Velcro, which typically you would have a Velcro strap on these. Once it's in place, you want to make sure that 2 fingers can fit behind the restraint. When attaching it to the bed, you want to make sure that it's actually to the bed frame and not the railing. And demonstration purposes, this will be the bed frame. You would then tie it around, again making sure there's enough mobility for that client that they are able to still move around and do that. Sorry, can't talk when I'm making a knot. So it'd be knotted like this, where it's a loop, a split. It doesn't want to tie tight to here, but that's to demonstrate how it would be done, just so it's for quick and easy removal. Once it's attached to the client, you want to assess the respiration rates, because it is a very anxious thing to get restraints on. They could have high anxiety, high respirations. We want to maintain that healthy vital sign. Again, making them comfortable. I would make him comfortable, raise the rail, and lower the bed. I would make sure the call light is within arm's reach for the client, and I would want to assess every hour, or according to facility policy, when you do an assessment, you would want to check their vital signs, their neurological assessment, just to make sure that they aren't overwhelmed, they're not showing signs of stress or anxiety and things like that. Every 2 hours, you would remove the restraints and provide range of motion. And of course, every time that you're checking, you want to make sure that the order's still in place, that it's still needed. If it does need to be extended, that you obtain that extension from the care provider. And then again, give that rationale for why it's needing to be extended. And again, do the same steps that you would do as you first did it.